So your drainage system is typically going to come with three major components. The first component is your actual drain. This is a pigtail drainage system. This shows what the drain looks like. Half of the drain is going to be in the patient, and about half of the drain is going to be sticking out of the patient. So this half is the part that you're going to see sticking out of the patient. The next component is your flushing system. In this particular situation, we have a Y connector type flushing system, and we'll talk about how the patients flush this. And then the third component is your drainage bag. One particular tip for the drainage bag is this port at the bottom of the bag is how the patients will empty the fluid that's in the bag. And so that's one part to troubleshoot when you're looking at the drain. So how is all this connected? Essentially, when the patient leaves the interventional radiology suite, we will connect the Y connector to the drain, and we will also then connect the bag to the portion of the Y connector that has the white clamp on it. So this is how your standard system, and this is how the patient should present to you when they come in. The way the Y connector system works is via path of least resistance. So as long as this clamp is open, the fluid will naturally drain into the bag. If we close this clamp, the fluid will not drain into the bag, but it also helps us in terms of how we flush the system. So some of the things to first look out for when you're troubleshooting these is to look and see whether the clamp is open if a patient says that they're not draining appropriately. So one of the things to look at when a patient comes in, for example, complaining of leakage, is these connections and making sure that they are tight. Another issue that may occur, potentially the drain being clamped after the patient has flushed it. And if they're not draining, it's possible that the clamp is closed. Another thing that I have seen sometimes is, if you remember, you can only see this part of the drain coming out of the patient. When the dressings are done, sometimes what will happen is the drain will be brought forward to the front of the patient. For example, for a PCN, if this is the patient's back, when the dressings are placed, the drain is brought to the front. And what that essentially does is that it kinks the drain and prevents it from draining. Sometimes this is hard to see because this part of the drain is underneath some of the dressing. So it might be necessary to take down the dressing to look at it. But if you're getting to that point in terms of troubleshooting the drain, then it's probably best to call IR to let them come and do that part of troubleshooting. So in terms of flushing the drain, we typically ask patients to flush once or twice a day. We'll typically ask them to flush 5 cc's of sterile saline into the drain and 5 cc's into the bag so that we can keep the whole system open. There are, of course, variations in practice when it comes to this with different IR departments at different institutions. So you can check with your particular institution to figure out what configuration they come with and what they're telling patients to do as far as flushing goes. So in terms of flushing, the tools that you'll need are basically a sterile saline syringe, about 10 cc's, an alcohol prep pad, some gloves or hand sanitizer. And the first thing that you would do is sanitize your hands. And then you'll basically take your prep pad and work on your flushing mechanism here, which consists of a blue clave and sometimes a green cap. And the goal is to keep everything sterile while you're doing this. So what you'll do is you'll unscrew the green cap and you'll clean the clave with some alcohol. And then you'll take the 10 cc saline flush and attach that to the blue clave. Sometimes what you have to do is push a little bit because there will be some resistance there. And like I said before, the path of least resistance is into the bag as long as the clamp is open. And so when I flush with the syringe here, for example, most of the fluid should go into the bag, and that's how the patient will flush into the bag. And then if I clamp this now, the path of least resistance is into the patient. And so when I flush here, the saline will go into the patient, and that's how the patient will flush into their system. One thing to remember is to make sure that you unclamp this after you flush it so that the patient can drain normally. And then once that's done, you can take off the saline syringe, and then you can wipe it if you want. And then if it came with a green cap, you can place a green cap over it. So some of the troubleshooting things, like I said, is making sure that the drain is not kinked, or looking to see the possibility that the drain is kinked. Sometimes what we'll do is we'll ask for imaging, perhaps a KUB, because we can actually see that the drain may be kinked on a KUB. We can also see whether it's in a different position. Also looking at the connections here between the Y connector and the drain, and between the bag and the drain, and making sure that those are tight and there's no leakage, making sure the clamp is actually open and not clamped. And then one last thing that's nice for the patient is also looking at the end of the bag where the screw system is to make sure that everything is tight and that there is no leakage.